So coming to the next talk, and next talk is by Dr. MAYUR Bharali. He is presently working at Nalbari Eye Hospital at Nalbari and Guwahati, Assam. So he'll be speaking on fluid loss through side port and chamber instability, another difficulty that we encounter while doing our phaco surgeries.
So thank you, Dr. Jayashree, for giving me this opportunity. So today I'll be talking on fluid loss through side port and making the chamber unstable. This is normally we overlook in whole of fluidics, thinking about vacuum pressure, infusion pressure, and all those things. But there is one thing which occurs normally. There is a fluid loss through side port. This video we can see. I have zoomed it towards the side port only. See, it's look like a leaking tape. In our home, if this occurs, we will have to call a plumber for this, but we are proceeding with a phacoemulsification in this case with so much of fluid, whatever infusion is coming, all of it's going outside through the side port. If you can see, I have zoomed it to the side port. So what is the background? Phacoemulsification nowadays has become most preferred technique for cataract removal. It involves ultrasound and a fluid flow, the fluidics. That is most important in case of a phacoemulsification. Fluidics is a term used to describe the balanced fluid flow, inflow, outflow, and a balance between the two is most important to keep the anterior chamber stable. This is a very raw diagram. We can see a phacoemulsification machine in the center, and it is a gravity-based fluid. So it is fluid is up. The fluid comes through the machine, goes to the eye. It should come out through the aspiration port to the machine again to the drain bag. But if this fluid bypasses and it comes out like the video I have shown, that is fluid loss through the side port. So modern phaco machines either have a very peristaltic or venturi machine already described by Dr. Arundhati. So BSS running out and excess pump speed, these are the two important causes of chamber instability or the chamber collapse. So fluid flow related issues are like surge, vacuum loss. If it occurs, that occlusion breaks, post occlusion surge, and the PCR most commonly. Fluid loss through the side port causing chamber instability is normally overlooked, and it is the important factor which is not given its due. So what are the important fluid flow related issues? First of all, that the fluid is important to maintain the IOP. Proper fluid flow ensures that the chamber remains deep and stable. Then visualization of the surgical field, which is also very important to remove the debris. Our cornea should be wet, or inside whatever debris in the AC, we have to remove it. So that is also important for fluidics. Then control of lens fragmentation. The fluid should come to the probe, phaco probe, and it should goes out, not the other way around through the side ports or the main port. In fact, main port, some amount of fluid leakage should occur because it keeps the wound, main incision wound, and it avoid the burning of the wound also, but not through the side port. And then it helps in lens fragmentation and prevention of complication, and by maintaining the proper anterior chamber. So fluid flow is critical for the success of phacoemulsification surgery. Now, incision fluid loss. The anterior chamber can be viewed as all practical purposes as a closed system between the atmospheric pressure and the posterior vitreous pressure. So anterior chamber is primarily influenced by the balance between the influx of irrigation fluid and the efflux through the main or the side ports. A fluid loss through the side port incision can cause disruption, and two of the important pressures which is related to the fluid flow is the vacuum pressure, that is the negative pressure, or the suction pressure. It disturbs when the fluid goes out through the side port, or the infusion pressure, that is in case of a gravity based infusion from the bag, fluid coming from the infusion bag, or in a active fluidics where like a higher end machine like Centurion, where the infusion pressure is maintained by those plates pressing over the bag. So proper side port size is very crucial in maintaining the fluid dynamics. It has been calculated that about 67% of the fluid which is used during the phaco surgery is lost through the side ports, and we overlook that. Fluid loss through the side port can occur due to poorly constructed wounds. The side port should be suitably sized for the second-hand instrument. Whatever the size of the second-hand instrument, sometimes we use those iris spatula or blunt. They can be bigger, smaller. So we have to look whichever instrument we are using, our side port should be there. And sometimes removing the second hand instrument before removal of the last fragment is helpful also to make the chamber stable. The size of the side port is directly related to the fluidic stability of the anterior chamber. If the side port is too large, there's a risk of excessive fluid leakage and leading to a decrease in the intraocular pressure or subsequent chamber instability and complication. But on the other hand, if the side port is too small, there's a risk of insufficient fluid flow leading to increase in the intraocular fluid pressure, subsequent chamber instability. A smaller side port can provide better fluidic control, but may limit the instrument maneuverability, while a larger side port can provide more instrument maneuverability but may compromise the fluid control. The side port should be constructed properly. The size of the incision should be appropriate for the size of the IA probes also used. So IA probes are different gauge IA probes we get. The proper appropriate instrument should be used. Other factors like vacuum setting, phaco power, irrigation should be carefully monitored and adjusted. If the fluid loss occurs, we should stop the surgery immediately. Now, if it occur like my previous video, if it is occurring, then in that scenario we should stop. We should not use that side port, and we should make another side port from another paracentesis, and then we should proceed. Sometime we have to close that side port also by giving incision. So in summary, fluid flow is critical to the success of phacoemulsification surgery. Proper management of fluid flow ensures a stable intraocular pressure, a clear surgical field, efficient lens fragmentation, and prevention of complications. So it is important to have a thorough understanding of the fluidics. Then regular monitoring of the IOP chamber instability during the surgery also helps the surgeon to identify the fluid related issues. So I'll go to this video actually to the last. You can see this is a normal case. What we should do and we shouldn't do. Normally when manual surgeons convert to phaco surgery, then what happens is that we use normally 15 degree side ports, and we have a habit of just increasing to the side. So we should not do that, and we should use these 1 mm side ports that directly give us only 1 mm incisions. So in this case already side ports are made. I'll not show the rhexis part and hydro part, etc. But see, now the second hand instrument is being used after the phaco probe is inserted. See, there's a very less leakage or to no leakage actually. So in this scenario, there is no problem to progress with phacoemulsification, and normally we don't look for these side ports, and our whole concentration is in the nucleus removal. This is another case. If we can see now, same I have made 2 paracentesis or side port incision using these type of blades are good actually, and no sideward movement. So normally what happens is a manual SICS, we need those sideward movements to put, because we have to think about putting the Simcoe also. But in this case we don't require, so we shouldn't. So already rhexis is done, hydro is done. This is a mature white cataract, and it doesn't look soft because a brownish tinge is coming from inside. Now see, there is a leakage in this case. If you can see here, yeah. So there is leakage in this case. But this is I'm doing in a Centurion where active fluidics. So normally these machines take care of those excess fluid loss by pressing the plates more and maintaining a stable IOP. So fluid loss is there, but still we can go through the phacoemulsing procedure. There I'm doing direct vertical chopping. That is routine. So not thinking more about that fluid loss, whatever is happening till now. I'll just make it fast, the nucleus removal and all. And due to the fluid loss, you can see there is the visualization is also a problem because of the water over. Now the last piece removal is there. Normally otherwise there is no problem would have happened with that fluid loss, but because my fluidics is already disturbed due to the side port fluid loss, and suddenly I have this last piece removal, there is a PCR. So I don't come out, which is a dictum. In case of PCR, we don't come out. I put the viscoelastic from the anterior chamber, but still these are common things. So yeah, so side port fluid loss is important, and we should not overlook this condition, and it occurs more frequently than not.